Well, as we turn a corner in the coronavirus pandemic, doctors and nurses are coming up on 2 years of caring for COVID patients. COVID hospitalizations nationwide and in our area are dropping. What a relief, right? It's relieving intense pressure that was on healthcare systems during the Omicron surge. WCNC Charlotte's Chloe Leshner checked in with a Novant Health ICU nurse today, and she has more on her experiences.
New data shows that nurses are exhausted. A Novant Health ICU nurse tells me she is seeing it firsthand in the hospital as more and more of her colleagues are leaving the bedside. Through the peaks and valleys of every COVID surge, frontline healthcare workers have been showing up for patients.
Honestly, in this kind of role, you just have to be resilient.
Diana Tejada-Pareda is an ICU nurse at Novant Health. She's cared for the sickest patients over the past 2 years, and it can take a mental toll.
I think I've had pretty good coping mechanisms. Like, I have really good coworkers who are like my best friends who we've talked through our issues.
The trauma and exhaustion has been too much for some. IntelliCare is a resource for nurses. Its research group found 56% say they're sacrificing their mental health for the job, and more than 40% of nurses surveyed are considering leaving the job. It's happening at our hospitals too.
We are burned out. The physicians for sure are burned out. We've just had a lot of turnover just because of people leaving to go travel nursing or leaving the bedside altogether.
A positive sign, it's slowing down now, and Tejada-Pareda says it's been a relief to care for mostly non-COVID patients.
It's just unbelievable, really. I'm just glad that it's phasing out and, this is our new normal, so it is what it is.
She thinks money is a big factor in driving nurses out. She says at one point travel nurses were making 4 times more than nurses inside of the hospital. But she is hopeful that as demand for those travel nurses goes down, more will come back to relieve some of the pressure of staffing shortages. In Charlotte, Chloe Leshner, WCNC Charlotte.
Chloe, thanks. And remember, we'll continue to follow all COVID-related stories like this one and post any updates on our website. And you can also text the word coronavirus to 704-329-3600. We'll send you a link straight to your phone with the information you need.